of hours has gone so quickly. But we are moving on to the workshop with individual healthcare plans within school settings across LLR, so Leicester, Leicestershire and Rutland. And my name is Holeigh Oates. I'm the Associate Designated Officer for SEND. Now, I'm not a designated clinical officer as I am non-medical. I'm from a health background. So bringing my role into the ICB has been something that we have worked for the last couple of years. And I'm currently on secondment, so thinking about how we can support those schools with medical needs young people instead of their SEND needs. Right, so obviously individual healthcare plans are for any child or young person that attends a school setting that has a lifelong medical condition. And we know that over the time that we're seeing and the pupils that we are seeing going into our mainstream schools, that they have got increasing complex medical needs and medical conditions. And we would always recommend that an individual healthcare plan for any individual that has a recognised or diagnosed medical need. So that is where there's potential, and this is how we've been promoting it, where there's potential that you could be impacting them accessing an education and accessing the curriculum, or where there's potential that it is going to impact their attendance. So obviously the legislation, especially supporting pupils at school with medical conditions, 2015, is primarily the focus of my work that I've been doing for the last 18 months, introducing and showing schools and any other services across the LLR the benefits of creating and implementing individual healthcare plans to show that support that's being offered for those young people. And obviously that is then backed by the Children and Families Act, Section 100. You've got the Equality Act. You've also got the SEND Code of Practice, 6.9 and 6.11. And there's the emphasis back onto schools about implementing the correct support for their medical condition out of what I hate being called the notional budget, your element 1 and element 2 funding, before reaching out to the local authorities for additional funding to support that young person. So the responsibilities of the governors, obviously within supporting children with medical needs, we have got this emphasis onto schools around individual health care plans, that the governors play a vital role in ensuring schools have effective individual healthcare plans in place. They must ensure that arrangements are in place for the schools to support pupils. They ensure that the school leaders consult health and social care professionals, and they must ensure that arrangements are in place to support pupils with those medical conditions. So it's just a kind of just making sure that we are covering the guidance that is recommended within the policies. So something that we really share with schools and services across the LLR is the 6 key points that we've created as being pivotal to the support that they put in place. Then it's part of their graduated response. Obviously, we have such great avenues for our SEND children, but where there is a medical condition, we don't have the same level across the LLR of that understanding of that graduated response and that graduated approach to be able to reach out to additional services. So it's a real key way of providing that information, whether they are reaching out to local authorities for statutory assessment, or whether they are then reaching out to inclusion teams for children with medical needs. It's part of that graduated response that they are able to provide that as evidence. You've got that the parent and CYP voice are heard. These are the ones that obviously have lived through that experience pre-diagnosis, going through the diagnosis and post-diagnosis. They know the kind of little bits of quirks within that individual with that medical condition, and actually it's a great way for those communications. And again, we were talking about that, was mentioned this morning, about those communications and building those relationships within the school setting. It's a central information point, so everything within the individual healthcare plan is used, especially if there is emergency situation where that young person may need an ambulance, may need paramedic support. Everything is in there so that it could be timely support that's being offered. You've also got the support and guidance from professionals. Now, I really encourage schools to kind of reach out to professionals. I don't expect or would never expect professionals, health professionals, to attend all of the meetings for individual healthcare plans, but obviously reports, appointment letters, any other forms of communication can be really pivotal in kind of having that input into the individual healthcare plan. So they're also reviewed annually. And unless there are any significant changes within their medical needs, whether it might be they've been hospitalised for some reason, they've got a change in medication, it could be that they've had an operation and they've had a time off school. So there's been a change within them their medical condition that would need to be communicated with school. And also, if you've got all of that information and you know how that medical condition is impacting that young person as an individual, hopefully that staff within the setting would have the knowledge and understanding to be able to put that support in place and feel confident to be able to put in the appropriate support. So thinking about the quick understanding of that, which we would then share so that anybody that's within our settings would be able to have that understanding. It just gives you a quick summary of the last slide. So what have we been doing across LLR? So like I say, within the last 18 months which I've been in post, we have started to present and share this information with all settings, services, education and health professionals and social care as well. So it's about anybody and everybody having the same message and everybody then having that understanding of what an individual healthcare plan is, why we have them and what the benefits are. So there's a list of some of what we've been trying to implement across the LLR. So presenting and sharing information with school settings, individual and academy trust levels. Excuse me. Information's been shared with the local authorities, so early years, SEND, inclusion departments. We've also shared with social care. It just means that everybody that's working with the schools or having any communication with the schools, that we are all recommending the same, that if there is a medical need that is potentially impacting education and attendance, that we are starting to look at an individual healthcare plan for that young person. So we've shared with all other professionals, Zendy Espinados and virtual schools. We've started doing some work with Leicestershire Partnership Trust, including CAMS. We've also had some sessions with specialist nurses from University Hospitals of Leicester. So those that are implementing health action plans, that when they are being seen by the specialist nurses at UHL, they've also started understanding that they are potentially going to be feeding into an individual healthcare plan within the school setting as well. So thinking about the information and the recommendations that they are putting in place. We've been sharing information at our SEND roadshows, so they are across Leicestershire. They're part of the local offer within the Leicester City and Leicester County. And parents are able to come along to those roadshows and gather that information and understanding about individual healthcare plans as well. It's in terms of things like a young person that I was speaking to a parent about quite recently, that her 7-year-old was unable to attend school or reluctant to attend school because he had continence issues. And when we talked about it, what he would need would be around, being able to signal when he needs to go to the toilet without putting his hand up. So some kind of form of a card or some way that acknowledged for staff to know that actually he was going to be out of the room for a little bit longer, but also to know which toilet he could go to. And those are reasonable adjustments for the school to be able to make in putting in that plan to understand his medical need. And I think for parents to understand, I know I've had a parent this morning while we were on call this morning, a parent's reached out through a social worker because their 14-year-old is getting into significant trouble when he's got his phone out, but he's diabetic, and he's got on his phone, he's got his app to monitor his blood sugars, but he's getting into trouble within the school setting when he gets his phone out or when he's having additional snacks because he's actually a little bit low. And what we'll do is we'll offer the school some generic support in understanding the benefits of the individual healthcare plan so that they can put that in going forward. So we've been participating in health events that have been organised across Leicestershire and Rutland. We've also worked with LAs to look at health advice within the HCPs and how an individual healthcare plan can support and work alongside an education and healthcare plan. I think my biggest stumbling block across the LLR is our specialist settings in terms of them saying that they have an EHCP, so they don't need an individual healthcare plan. But actually, we know that they can work quite crucially alongside each other. And I have got an activity in a little while that we can talk through that will demonstrate that quite nicely. So we've been sharing information with other ICBs and obviously sharing the information with you guys this morning as well, which is really pivotal into what we're doing and trying to share that so that we can kind of, if we've come across stumbling blocks already, hopefully we'll be able to support in being able to implement this on a wider scale than just the LLR. So we've been part of a working group for early years in Leicestershire to promote and create an early years template. So we've taken the one that we've adapted from the Department of Education guidance with supporting children with medical needs, and we've adapted that for the LLR. But then Leicester County early years have taken that a step further and have adapted it for early years template, and they've also put some support and guidance which they've added onto their local authorities webpage. The IHCP information has been added to the website Autism Space through Leicestershire Partnership Trust, and we are working in collaboration with LAs around Section 19 and children with medical needs policies and guidance. The plan going forward is hopefully we are going to get to a point of sustainability, but to encourage that sustainability, we are going to produce an individual healthcare toolkit, which will allow schools and LAs to use that as freely as required. We're going to have a regular newsletter update on a termly basis that will be going into school from the ICB around children with medical needs, and just keeping that the children with medical needs at the forefront of everyone's thoughts. And then we are also looking at the support and provision, so offering workshops, information sharing sessions. Last week I recently did one within our local area within Leicestershire where I had 16 schools attend from one area, and that was really crucial to their development. We had new staff, existing staff, but we came together as a group, and then we kind of had a 2-hour session to talk around individual healthcare plans, and we then have been able to produce that, so looking at taking that into other areas within our localities so that we're offering that on a regular basis. Is there any questions at that point? No? Perfect. Oh, yes, there is.
Sorry, it was just, that's all right. I just wondered if you'd be happy to share at some point when you've got your toolkit up and running, or is there something that you've based the toolkit on that already exists?
Absolutely. So I can show you the toolkit as it is at the moment. So it is a work in progress, and it is something that I've been working on for the last couple of months. And then once I've got that to the point that I'll be able to share that wider. But yeah, absolutely. If there's time at the end of the session, I'm quite happy to share where it's up to at the moment. So in terms of the individual healthcare plan template, and this has been adapted and is still being adapted. We've, I say to schools and professionals, I'm really not precious over this. This is something that we're constantly adapting. And I will look at this template in a little bit more detail with you before the end of the session. But we've taken the generic one from the website, and we've looked at the needs of our local authorities, of our schools, of our young people, of our providers within the LLR, and we've adapted it to be out. Now, to meet that need. It is a lengthier document, and obviously schools putting that in place, it takes that time to get it up and running. So we are encouraging them to invest that time, because once it's up and running, and it's all there, it's then just about adapting it as we go through, as they go through, as that young person then goes through education. So we have adapted it, like I say, and they are able to take bits out, add bits in, and we've had not only schools and the local authorities have had an input into this, but we've also had parent carers, we've had the likes of CAMS that have had an input into this, and it is ongoing. We are in the process of doing some work with young people to how the young person would like to get their voice into the individual healthcare plan. So we're working with groups across Leicestershire and Rutland to be able to get that into there as well, especially once they are hitting upper key stage 2 and beyond. We've also developed a very quick information flyer, and this is shared with parents and at the local offer roadshows. So this is something that parents are able to take away, but it's also something that the schools across Leicestershire especially have started putting onto their websites. So it just gives that understanding of what an individual healthcare plan in the who, what, why, when and how, and they can go from there. So also we've been looking at the differences, because we get asked what the difference between an EHCP and an IHCP is quite often. And so we've just kind of very quickly been able to share that information in terms of that legal document, whether the IHCP is that statutory guidance. Obviously, they're both reviewed annually. But we've also got that if they have an EHCP, so they have a SEND need, then we can also have a medical need, and they might be completely separate. But also we have this overlap. Just one moment, really sorry. I'm so sorry about that. If the earlier ones on the call would have heard that my laptop has a virus that it told me late yesterday afternoon, so I'm actually waiting for an engineer to come and pick it up, and he was just ringing me straight in the middle of all of that, so I'm very sorry. So both plans are important, they're different and work well alongside each other. Whether you have, the child may have a SEN, may have a medical need, however the plans work well in isolation, but they also work well with each other. So again, that's something that we would share. So working together, EHCPs and IHCPs, just having a think around medical needs being identified with section C and G within an EHCP. An IHCP can then detail that need. So that's how we differentiate between the two. So where there is a medical need identified, the IHCP would detail that need. EHCPs relate to obviously our special educational needs that affect how the child can access education, and the IHCPs are about the management of the child's medical need every day. So thinking about an EHCP and an IHCP and how they can work together, I'm just going to go to if I can find it. It was there. So this is a redacted education and healthcare plan that was part of the Leicestershire and was issued late last academic year. So we have got this young person, and if I go down to section C and G, I just want to highlight how if a school setting was receiving this information, how are they going to support that young person? So we have got section C, and I just will scroll down very, very slowly in terms of this young person who has Down syndrome. And you can see that we have got following being born. This young person, I must add, is 16 years old. So this EHCP is quite far into her education journey. And this is the information that's been received. I'll just give you a couple of minutes as I'm scrolling through, as I don't jump too much. As you can see, this is quite a lot of information.
We do have a question in the chat.
Yep.
Holeigh. So looks like a useful document. May I ask who leads on the writing and update keeping this document accurate? I am also wondering about buy-in from schools and this supported by a local area agreement protocol to use this for all CYP medical needs in schools.
So obviously, IHCPs are at the discretion of the head teacher or senior leaders within school. So it's always about, like you say, the schools have to have that buy-in. They have to understand what the benefits to the school setting is going to be. And so we have got, and we are really fortunate that the connections and the communication and the interactions and relationships that we've made across the LLR have been really positive. And we do have a lot of buy-in from our schools and from other services, because actually we all recognise about how we are trying to benefit the young people within our localities. So obviously they are at the head's discretion, but we are trying to make everybody have that understanding that it's really part of their early graduated approach in terms of, because what we find is across especially Leicestershire is that we're reaching out for additional funding and it gets declined because it's for a medical reason. And obviously the only downfall with all of this is that there is no funding with an individual healthcare plan, unless they are, extremes of continuing care. So what we're really trying to promote is that actually what we need to do is that schools need to understand how they are differing the support that they're giving regarding whether it's a health need or whether it's a SEN need. So, for example, when I was working in a school setting, I had a young person who was just starting in early years, and she came into us with a stoma bag, and she obviously needed for the school to be able to meet her medical need, that we needed to take her out of the classroom twice a day to be able to make sure that her stoma was clean. We needed to change. We needed to make sure she was comfortable. So twice a day for about 20-30 minutes at a time, because of where her classroom was to where the clinic was that we needed to go and change her in. It would take 2 members of staff. And actually, as a school, we had to meet her medical need and be able to do that. But actually, when you look at the provision that she needs when she goes back into the classroom, because of the times of the day, she would come out during her phonics session. So actually, she needed some one-to-one support. She needed some group support for her phonics, just so that she didn't fall behind with those real foundations and basic education building blocks. She would also need some fine motor skills intervention, because actually that was part of the phonics session when she came out of the room. She needed some ELSA, because obviously she was a little bit different, just from having the stoma, and nobody else within her class went out with 2 members of staff on such a regular basis. And also she had some social time with others, so that they had that understanding of her needs as well, and knew that she was still one of their peers, and not different to them, apart from she had this medical condition. So all of that I've just listed is her special educational needs provision. So how she can access education and how she can access her learning. So actually what we need to start to do is really unpick the difference between the two. And so when we look at the individual healthcare plan, I think what you'll see, and using that as an example, is that you will see how we start to do that. So the template that we've adapted, and you will see some of this is familiar from the website, is around individual healthcare plans. So obviously the date it was created and when the annual review is due to take place. You've then got their medical needs. So everything on that front page is giving that basic information. And thinking about that young person, and how we could implement, and what we could take from the EHCP and put into this, I think there was very limited information. It doesn't give us a clear understanding of how to support her needs, and what support she would need on a day-to-day basis. Although there was huge amounts of information in there, going back to when she'd been born and the difficulties that she'd had to where she got to today, there was very little provision recommended or suggested within there. So then we look at the family contact. Now this is anybody that's involved with that young person, and they don't necessarily have to be at any meeting. It's just who you can reach out to as a setting, who you can reach out to, because what we need to do, and this is something that reiterating from this morning, is we need to close the gap between health and education. There are certain young people, there are key times that these two services need to work together, and that's something, again, within my role, that we've tried to start to do in terms of having a contact within health that can direct. I don't have all of the answers for these schools, but actually can go away and find an answer or find someone for them to contact moving on. So again, trying to support the school to gather all of the appropriate information, and so they can take that forward. You've then got their medical conditions and any treatments, and then you've got any prescriptions and dosages. Now, this is anything from very beginning of the morning to very late at night, and things that we need to take into account, even if they're not being administrated at school. But again, it's that timely support if there was a worst case scenario where an ambulance is required. And actually as well, when you look at the next part, understanding the side effects of the treatment and medication. I know I've worked with a year 3 child, so he was 7 and 8 at the time, and he had severe epilepsy, but at night he would also take sleeping medication. So sleeping medication at night, his epileptic medication in the morning, and that first hour of school on a daily basis was tricky, and those reasonable adjustments and best endeavours that we needed to put in place for that first hour, as one was wearing off and one was kicking in, that first hour of the day would sometimes be more of a challenge than not, but to get him through and understand that actually get through that hour of the day, things are going to change, because actually it's the side effects and conditions of that of those behaviours and side effects of that medication. So thinking about routine monitoring, and this feeds in back into hospital appointments if there's times when they need excess water, or if they've a toilet, how many times they're going to the toilet, or having accidents. This can all be something that parents can share at this point. Again, emergency situations. And then we'll start to look at the impact on the child or your person's learning. So thinking about coordination, is there things that we need to adapt for PE maybe, or when they're in the playground, and those assessments that we're taking, that we're doing on that young person. Care at meal times. So not just those that are peg fed, but also if there's any other conditions or things that we need to monitor at that point. Toileting. Actions and reasonable adjustments to manage the day. So when we're looking at reasonable adjustments, if we're starting to implement 5, 6 across a school day, okay, obviously school are able to put those in place. If we're starting to think that we need to put in 35 to 40 a day or across the week, then actually when is that tipping over into special educational provision for schools to be able to reach out and say that they are having to put in this extensive amount of support for that young person to access their education system? Physical activities and then trips away. Thinking about travel times and where things are taking place, how you're going to access their medical needs when they're out, but also the school environment and social and emotional needs. Now, this is really key, especially if you have got anxious children or anxious young people who are having time off school, whether it's 2 days off or 2 weeks off. What does that first day look like when they come back? And it'll just try and reduce some of those anxieties about them actually being able to get into school. And obviously this goes through about what that young person's going to need. Staff training. Now, it might be really straightforward as to where any staff training is going to come from, maybe a diabetic nurse. However, there are going to be some other training that isn't so clear as to where it comes from. In terms of the young person, I had one a few months ago where the young person was having they had a peg for gas release, and we were thinking about the training because all of the training led them to peg feeding, and so we were able to source some training for them, and just keeping a log of where that is really beneficial for the school, so that in 12 months time we're not in the same situation. And then obviously it's just signed off with any additional information part at the end. So going back to here, I think you can see how we could use that information.
There is just one question in the chat.
Yep.
I don't know if you want to quickly go into it, and then just a heads up, we've got about 8 minutes left.
Yeah.
So Deborah said, what governance arrangements are currently in place to ensure robust risk management, clear accountability, and effective routes for escalation when issues arise?
So that is something that we are working on, because obviously we're at the very early stages of our journey, and so we are obviously we're in the process at the moment of putting that ownership back onto schools, and hoping that when we are seeing them reach out to local authorities, that we are seeing those individual healthcare plans being either recommended or they are coming in as evidence, which we have seen within Leicestershire and Leicester City recently. We are raising the understanding of individual healthcare plans, and also seeing them being recommended. You can see from the letter of the University Hospitals of Leicester, we don't at the moment have anything that we are able to monitor with the schools. But the avenues that we are able to have within schools is that we are working with some academies where they are producing information and data for us, but that is kind of an ongoing piece, so there isn't anything at the moment. So unfortunately that doesn't really answer the question. Because they are non-statutory, it then becomes quite hard to enforce. Deborah, do you want to come in?
Yeah, and I'm just thinking about that joint responsibility, working together, and when you place a lot of that on schools, which you can do, that you lose some of that joint support, joint collaboration. So just thinking about stronger governance across the partnership is really helpful, I suppose, as you move forward.
Yeah, I think with them being non-statutory, we're offering them that avenue of having a way that they can gather all of that information, and understanding, and so they have that understanding of the benefits, and And actually, schools, when we have reached out to individual schools, they are really welcoming. Just a key person to be able to contact. Like I say, it's not regarding my knowledge and answers necessarily, but having that guidance of where they can go. But just like any ICB, it's really tricky when we have more than one local authority that we're working across. But yeah, I completely appreciate your comment, Deborah. Thank you. We have another hand up.
Hi, I'm Madeline
Hi.
Gibbs. Thank you for presenting this. It sounds really amazing and definitely in the right direction of travel. I think you kind of alluded to it in that if schools, if a child or young person's medical needs that needs to be managed by schools has exceeded the you mentioned element 1 and element 2's funding, so i.e. outside of the SEND notional budget, then what happens in that situation where we often find children kind of stuck between a rock and a hard place in terms of funding? They don't quite meet CCHC,
No.
and the schools are saying, well, we can't, we'd like to meet NEET, but we can't because we don't have the funding for this, the level of staffing or the resource to manage that. And I just wonder how you navigate those conversations. I get you're a good partnership, but how do you get over that hump?
Yeah, absolutely. And this is something that obviously the challenges we all face, isn't it? I think for me, it's about that distinction between the two, between that medical need and the SEND provision that they put in place. And actually, there was a tribunal case that we had where the young person was in a wheelchair, and the school were reaching out for additional support as well at the time because he had a wheelchair. But actually, when they started to unpick the difference between moving him, which they could do, or put him into his standing frame, what was the provision that looked like? And actually, even the Senko said when we'd had that discussion that she started to think differently. So I think it's about the main thing is around trying to identify that medical need so that the school have such a clear understanding of that medical need, and feel that they can support, but actually what's the special education provision that's needed. So there's two very different aspects of where that funding would come from, and I think it's about schools having that clear understanding of how they're meeting that medical need on a real clear basis, and what's expected of them with their medical need before they can move on to the next.
That's great, thank you.
And that is me. So obviously if there are any other questions, we have got 2 minutes just to finish before we finish off and have a break before your next workshop.
Sorry, me again. I've put it in the chat, but I was just wondering, you talked about the delivery of training, and I just wondered how that is commissioned, because obviously there's lots of different types of medical needs, and how does the ICB fund this, and how do they do it?
So we do it through my role. So we don't have it necessarily. We don't necessarily call it training. We have it as information sharing sessions. So we've done that. Like I say, with individual schools, if schools have reached out, we do some generic support. We also we've reached out to Academy Trust, and like I say, last week we did start to implement that at locality across Leicestershire and Leicester. So looking at implementing that on a yearly basis, just offering that invite out, but that is done from within my role.
Can I just clarify the role of the school health nurses in training for, like the more generic conditions like asthma and so on and so forth?
So across the country, so they would still offer that through their service, but this is where the information is then gathered. Okay. And I think I'm going to say thank you. Is that everything?
Thank you.